Hi, Dr. Raj here, and today we're going to talk about amiodarone and thyroid dysfunction. Amiodarone is my favorite class 3 antiarrhythmic for the board exams. It loves to inhibit those potassium channels, and it does cause thyroid dysfunction. So, if you're going to start amiodarone on a patient, be sure to get a baseline thyroid function test, which means a TSH and a free T4. And while they're on amiodarone, monitor for signs of thyroid dysfunction, and periodically, maybe in 3 months and 6 months, check another thyroid function test. So, what is the most common dysfunction with the thyroid gland and being on amiodarone? The answer is hypothyroidism. Why? Is because amiodarone can inhibit the conversion of T4 to T3, which is the active form of thyroid hormone, and it could actually block some of the T3 receptors. But if you get hyperthyroidism, think about something called amiodarone-induced thyroid toxicosis, AIT. There are two types. Type 1 is that maybe the individual is predisposed to a hyperfunctioning gland, such as having Graves' disease or a multinodular goiter, or maybe they have an adenoma. And when you give amiodarone, which contains iodine, it's going to produce more thyroid hormone. Or it could be type 2, which is amiodarone in itself can cause the gland to be inflamed and release that thyroid hormone. So how do you know if it's type 1 or type 2? Well, the first thing I would do is, beyond checking thyroid function test, getting a ultrasound. And when you get the ultrasound, maybe you could see a 1-gland adenoma, a multinodular goiter, or when you order that ultrasound, get a Doppler flow evaluation, looking for that blood flow going to the thyroid. If it's going to be a type 1, you'll get increased blood flow because there's a multinodular goiter, a hyperfunctioning gland. If it's type 2, then you won't get that increase in blood flow because the gland is going to be just inflamed. Those of you who are going to ask me, why not get a radioactive iodine take? Well, it doesn't help as much. Why? Is because if you're in an iodine-rich area, which is mainly everywhere here in the United States at least, that if you are taking amiodarone, which contains iodine, and you're giving radioactive iodine, that there's so much iodine that the gland will not take up the radioactive iodine. So it can't determine if it's type 1 or type 2. And that's why we use our history, our physical, and that ultrasound with Doppler flow evaluation to really try to help us. If it's a type 1 amiodarone-induced thyroid toxicosis, how do we treat it? Cool down the thyroid with medications such as PTU or methimazole. If it's a type 2, consider giving steroids, glucocorticoids. If you really can't tell the difference, which happens sometimes, you may want to consider giving both. And of course, someone's going to say, why not stop the amiodarone? And that's a good idea. But of course, talk to your cardiologist. It's all about risk and benefits and finding out why are they on the amiodarone to begin with. I hope you love these pearls for the board exam and to help your patients.